Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, in this video we can see some points which will be helpful for your upcoming exam. And today's point topic is from community section, that is levels of prevention of diseases. This is the video number 61 of important points section. So levels of prevention, we know the levels of prevention, that is primordial prevention, primary prevention, secondary prevention and tertiary prevention. These are the levels of prevention. Here we can see one by one. First one is primordial prevention. Primordial prevention means action taken prior to development of risk factors in a population is called the primordial prevention. So primordial prevention means we have to take some action to prevent the development of risk factors. For example, diabetes, hypertension, obesity and all. We have to do some measures, that is lifestyle modification and also avoidance of alcohol, exercise, yoga. These are all the methods to prevent development of risk factors. Okay, that is called the primordial prevention. And next is primary prevention. Primary prevention means action taken prior to one set of disease. So prior to one set of disease we have to take some action, that is called the primary prevention. That include health promotion and specific protection. General health promotion and specific protection. General health promotion methods include health education, lifestyle and behavioral changes, avoidance of environmental factors. These all general health promotion methods. And also specific protection, we can give some specific protection prior to one set of disease, that is supplementation of vitamin A, iron supplement, folic acid supplementation and immunization of various diseases. This all to prevent one set of diseases, that is called primary prevention. So primordial prevention and primary prevention. And next is secondary prevention. Secondary prevention means action taken to interrupt disease progress and prevent complications. So once the disease occurred in a person, we have to take some action to prevent its progress, and its complication. That is called secondary secondary prevention. For example, early diagnosis and treatment of the disease. So once the disease occurs in a population, we have to do early diagnosis and treatment, adequate treatment we have to give the people, so we can prevent the particular disease. That is called the secondary prevention. For example, case detection and adequate treatment, this is called the secondary prevention. And fourth one is tertiary prevention. Tertiary prevention include action taken in later phase of disease, that is after the disease we have to do some measures to rehabilitate the patient, that is called tertiary prevention. This include disability limitation and rehabilitation. So this is tertiary prevention. So the levels of preventive measures include primordial prevention, primary prevention, secondary prevention and tertiary prevention. Primary prevention methods include lifestyle modification and source reduction. Secondary prevention methods include early diagnosis and treatment of disease. Primary preventive measures include general health promotion and specific protection, and tertiary prevention methods include disability limitation and rehabilitation. Next point is period of isolation of some diseases. We will see first one, chickenpox. 6 days after one set of rash. For isolation of chickenpox, 6 days after one set of rash. And for cholera and diphtheria, 3 days after tetracycline started. And for polio, for adult 2 weeks, for children 6 weeks. And sputum positive tuberculosis, the isolation period include until 3 weeks of effective chemotherapy, and for mumps until swelling subside, and for pertussis it is 4 weeks for isolation. And next we will see some important points. Filariasis is also known as elephantiasis. And second point, yellow fever is a type of zoonotic disease. And the incubation period of yellow fever is 3 to 6 days. And the next point, the vaccine used for vaccination against yellow fever is 17D vaccine. This is an important question. And next point, cholera and yellow fever vaccine should be given 3 or more weeks apart. That is, the interval is 3 or more weeks. Okay, Paris green is also known as acetoarsenate. Acetoarsenate is known as Paris green. And the next point, Japanese encephalitis is caused by arbovirus, and the reservoir of Japanese encephalitis is birds and pigs. And Japanese encephalitis is transmitted to man by Culex tritaniorchus mosquito, and the incubation period of Japanese encephalitis is 1 to 2 weeks. And the next point, Culex tritaniorchus mosquito lives in a rice growing and pig forming region. That is the causative organism of Japanese encephalitis. The mosquito lives in rice growing and pig forming region.